Good afternoon, everyone, and welcome to this QPS Talk Time. You're all very welcome, and just take some time now to get away from the rest of the day and enjoy listening to us talk about stories today. This is our ninth QPS Talk Time of our Spring-Summer series, and I hope wherever you are today that the sun is shining, because it is certainly here in Dublin, and that you're getting to enjoy some of that good weather. So I will certainly name our speakers today, and we'll introduce them as we go along. It's a pleasure to welcome all our guests joining us. So we've got Ger Kilkelly and Loretta Jenkins joining us. Ger is Quality and Safety, Patient Safety Advisor, and Loretta is General Manager in the Incident Management team with the National QPS Directorate. And then we're also joined by Dr. Gemma Moore and Jacqui Browne. Gemma is a qualitative research and evaluation member of the NQPS team, and Jacqui is a member of the Safety and Quality Committee of the HSE board. And Juanita is here as well to share the discussion with us today. So I'm going to maybe just give a few brief thoughts on the importance of storytelling, and I suppose some of the experience I've had in using it in improving care. I think we're going to learn lots about how story can be used. We're going to hear about some of the tools and some of the resources that are available for people to use. But in particular, I suppose we want people to enjoy this and to maybe tap into their own inner storyteller, and this is a way you can really engage people. Yeah, so maybe a good place to start is what is story? Well, everybody knows what stories are. They've been kind of told to us since we were very small, and we're all used to hearing lots of stories. But a nice definition is it's an account of related events or characters, either true or made up, and that's really what a story is. But of course, it's so much more than that. And I think at its heart, story is about relationships. Obviously, from the definition there, it's about the relationship of the events to one another and the characters in the story. So it's how they relate to one another. That's an important part. And obviously, that makes up what we call the story arc. So usually stories have a beginning, a middle, and an end, or something that happens in the story, a transformation. Somebody is changed by something that happens. There's also, I suppose, the relationship of the storyteller and the audience, and certainly that's a way of connecting with people. And I think that's one of the things we really enjoy. Um, there's the relationship also of what the story means to me, and I suppose how this fits in with the story of me and my life and the things that are important to me. So all of these relationships, I think, are important. And why is storytelling important? Well, for all those reasons, I think it helps us to decide important things, maybe the most important things, what matters to me, what's the meaning of my life or my work, what's my purpose. And often stories are some of the best ways of making those things clear. Helps us make sense of the world. So it helps us figure out what's going on, and we often tell stories to each other or even to ourselves. And sometimes we tell those stories without knowing how they're going to unfold in order to make sense of the world. Um, Story also connects us through more than just the narrative facts of the story. So story involves feelings and imagination and intuition, as well as cognitive reasoning. So it engages so much more parts of us. And I think all of those things, when they come together, is what gives story its power. And it can acknowledge, complex things, things that might be hard to show in other terms, such as where there's a contradiction or a paradox. Um, Story shows and shapes, and even you would say define cultures. If you ask someone to define or to describe to you Irish culture, they'd probably start talking about some of our great storytellers, the likes of James Joyce or Roddy Doyle, people who've told and showed us what Irish culture is through stories. And finally, if story's fun, I think we generally enjoy it, and even if we use it to sometimes get upset, it's part of the entertainment of story. So I'm just going to share you three steps, I would say, to good storytelling, and this is something that anybody can use in their work. And I brought this together, I suppose, from having an interest in story over many years, and we use it a lot in the teaching that we do. And these three things seem to me very important. I think first of all, you've got the collection of stories, and then the crafting, and then finally the delivery of stories. So I think the secret of good storytelling is finding those little, what I call story kernels. So it's that little thing that is the heart of a story, and it's often there's a very good author who's got a podcast called Matthew Dix, and he talks about 5-second moments. Or small moments, surprises, little things that just kind of, that was interesting, something different happened there. And you know, the likelihood is all of these little moments happen to you every day, and most of them just pass by. So, one of the things you can do is just to get yourself a little bit more prepared and be on the lookout for these moments. Be aware that they happen, and I'm just not going to let them pass by. So if something strange or odd happens, you can just note it down. And I think, in a little diary or on your phone, something to make a note of it, because you will forget it. The other thing you can do is just reflect at the end of the day on, was there any of those little moments? Something happened that was unusual. Um, and to start to ask the question, could I build an important story around this? And what is a good story kernel? Well, it's got to have story stakes. So it's got to have some meaning. So something that happened. So it's seeing something or realizing something that you hadn't maybe seen before, or seeing it in a different way. Maybe it's a moment of insight, or one of those moments where the penny drops, or maybe it's something with some emotional stakes where you or somebody else felt happy or sad or surprised by something that happened. And so going on the lookout for these little story kernels is the first thing, I think, in collecting your story. When you do find it, I think it's to try and describe that moment of what happened in some detail, at least to yourself in the first place. And then remember that good moments are just as valid as bad ones, because we do often end up collecting bad stories, or stories where something has not gone right, because those often are what impact with us, and they are important. But I think we can also use stories of good moments. So once you've collected your little story kernels, or those small moments, you've got to put it together. And I think the first thing in all storytelling is that it must be believable. And that's something that is up to the crafting as much as anything else. So what I would say here is start with short and simple stories, and it doesn't have to be complex. And the more you practice, the better you'll get. If you're putting your story together, sometimes describing the opposite to the little kernel moment can be helpful. So if you were surprised by some sort of an interaction, maybe somebody was particularly kind, maybe describing a moment where somebody was less than kind, or if you saw something that you'd never seen before, why it surprised you. Um, One of the things about crafting stories is you don't always have to be entirely truthful to the story. Now, I think, especially using stories in quality and safety, I think we don't like to make up stories because we have so many good stories, but you can use a little bit of poetic license, certainly in terms of compressing time or reordering events, if it helps to tell the story. And a key tip, I think, is always to try and create a cinema in the mind, so that people can visualize what you're talking about. So it's important to locate your story somewhere, and that might be a place that you have to describe, or a time, so that people can start to, in their own minds at least, start to see what you're talking about. And then the last is to deliver the story. And again, back to starting small and with simple stories, practice. This is something that you can do, and people are generally very well disposed to hearing stories, and I think that is something you can use to your advantage. When you're telling story, it's often helpful to use the present tense as much as possible, because that, again, when you're creating that cinema in the mind or that picture, it makes people believe that they're there in the moment. So if you can use the present tense of this is happening, the person is talking, rather than using the past tense. One of the key things is always to try and show in stories rather than tell people. So by showing what a character does, by describing something that somebody does, it's much more important than telling people that somebody was kind or good or communicated well. So just simply describing what they've done. And I certainly would suggest, if you haven't watched this movie, and I imagine many people have, this is the movie Up. And if you want an example of show rather than tell, this is just a wonderful example of that. So the movie opens with a 5-minute scene where there are no words spoken, and in these little vignettes of the life of Carl and Ellie, they show like from when they met as teenagers right up until the end of Ellie's life, and there's not a word spoken, and it just shows you the power of good storytelling in showing. One of the important things, if you're talking about yourself, is just to and your role in the story is to kind of play your own role down. So marginalize your role. If you are going to be in the story, it's important to be a little self-deprecating or even funny about yourself, and that often helps the audience, the listeners, engage with you. And if you are there, it's also important just to identify maybe those transformation moments when the reason why you're telling the story, why something happened, why this is important, why you should listen to this story. And the last thing I'll say is just don't over prepare your story. So I think writing your story down or learning it word for word makes it a bit stunted. So I think sometimes just learning some key points along the way that helps you to structure and helps you remember how you're going to tell the story. Maybe memorizing your first or last few sentences can be helpful as well. And I'm just going to briefly mention, this is an exercise that we do on the postgraduate certificate in quality leadership program. And one of the first things we do when we meet all our participants is we ask them to interview a family member, a friend, or a colleague, people who are not their patients. And we ask them to question that person about the experience of receiving care. And I have to say, we've done this now for over 10 years, and it is a really powerful way of engaging people, and the stories we get back are so powerful. And we ask simple questions when people are telling their story. We ask them, to recall the story. How did it make them feel? So not just the factual nature of it. Why did they choose this particular event? And was there something transformational? Did they learn something? Did it change how they behaved afterwards? So this is a really simple exercise to do with people, and I think you can find lots of ways to demonstrate, and certainly person-centered care through the power of these stories. And this is probably a message you'll hear a number of times. It's no data without stories, and no stories without data. So stories are a powerful way of communicating, but when they're linked with data, they can become even more powerful. And so I'm going to tell you a little story just to finish about exactly that, about combining stories with data. So this is a slide that tells a story in itself. This is a project that I was involved in. It was one of the first quality improvement projects I did in Ireland, and we came up with this clever acronym. Well, I didn't. My wife came up with it. It was called LOVE. It was a hand hygiene improvement project. So look at my hands, and we wanted people to increase awareness of their compliance with hand hygiene data. So we went out and we did some observation, and we found that people were cleaning their hands only half the time, so 50% compliance with the 5 moments. So we said, we went back to everybody and I said, we've got a problem. We're only cleaning our hands half the time, and the nurses who I worked with said, we don't think that's true. We think we do it more often than that. and we think that other people maybe aren't doing it as much. And so we all agreed that we would go back and look again, but this time we'd measure and see which groups were doing it. And this was the graph we got. And as you can see there, lo and behold, no prize for guessing that the nurses were Group A. So they were taking 4 out of 5 of those hand hygiene compliance opportunities. And so I presented this data back, and everybody said to me, well, you went and got this, you need to do something with it. And so I decided I would go and talk to the people who were in Group E. And I went to talk to them, and I said to them, we've got a problem with hand hygiene. And the first thing they said to me was, no, we don't. This is when I first realized, the power of having data. So I whipped out this little chart that you see here, and I said, but I've got some data. This is from observations that we've done here. And then the next thing they said to me, well, we don't think that's right. And I said, well, we watched this over a week, and I was able to validate, where the data had come from. And then there was another pushback, which was, oh, well, we think there's just not enough sinks for us to wash our hands all the time. And this is, again, where I was able to use my data to say, but how comes, there's enough sinks for the 82% of the nurses to wash their hands all the time. So we eventually agreed that this was a problem and that we were going to do some things about it. But for me, this was really illustrating the power of having some data. It's just such a story of where that came home to me, and I think most people will realize the value of that. So I'm going to hand over to Loretta to kind of continue on this theme and talk about some of her work. Loretta and her colleagues have done a lot of work on the power of storytelling. They've developed resources and toolkits. And Loretta, are you there? And I'll hand over to you, please.
I'm here. If everybody can hear me?
Yeah.
Great. Okay. I suppose, first of all, to start off with, I'd just like to thank John and the team for giving us the opportunity to discuss the power of storytelling here today. And I want to start off with a Northern American Indian proverb. So, you tell me a fact and I will learn. You tell me the truth and I will believe. But if you tell me a story, it will live with me in my heart forever. Stories can be both positive or they can be negative, but all are worthy of sharing in the interest of learning within our system. Patient stories help us gather a glimpse of the view of the world from that person's perspective at that particular time. Our stories then, they can pack an emotional reality for us and they can pack a punch to us. They can bring the services and the organisations to life. And they provide the opportunity for all of us to have that emotional connection for what happened at that particular time. What are the benefits of storytelling? It puts us in the shoes of the storyteller and allows us to go on that journey with them and see it from their perspective. And it allows us to see what's important for the storyteller at that particular time. Storytelling is a strength and it injects reality into our being and our day-to-day practice. The stories, they're a useful way to document and to listen to the storyteller's truth. And what we mean by that is what happened, what was the impact of what happened, what was the outcome for them, and for us as an organisation then, what is our opportunity for learning? Stories are important because they highlight and give us the insight from first-hand experience, the experience that of the storyteller. They inspire patient-centred change, inspire confidence within our systems and our services. As I said before, we encourage both positive and negative stories, so it offers us the opportunity to celebrate good practice. Stories will also foster interpersonal learning and interprofessional learning. A lot of us have worked with storytellers for many years, and what we've learned along the way is that we understand it's not easy to tell a story sometimes. There is an element of bravery then for the storyteller, and it takes time to tell a story. I'm working with storytellers for 4 years, and we still haven't got as far as the narrative. Stories can be told in a number of ways. They can be told either verbally, vignette, or narratively, and we have a number of options in terms of stories. And it's important to remember from our perspective that this is a voluntary process, and people can remove their story at any time. In terms of the governance then of stories for incident management, All the stories are anonymised to person and place. The organisation involved in the story is made aware of that story development. Stories that are not developed are those that are in an alternative process, like the legal process or investigation or under review, systems analysis review process. And from our stories are approved and signed off by our Assistant National Director, Ms. Lorraine Swanberg. Back in 2020, a multidisciplinary team was developed, and they comprised of patient partners, the incident management team, the open disclosure team, the wider QPS Directorate staff, the staff from the CHO, acutes, and our National Ambulance Service. And we developed a toolkit for developing stories. The purpose of the toolkit then was to facilitate and support the person in articulating their experience in the form of a story, but also to support the story developer as well. And this toolkit is available on our website, and we would encourage the system and the services to use this toolkit when developing stories. And there we have our QR code. So our toolkit is part of the Patient Safety Together resources. Our stories are housed then on the Patient Safety Together Learning, Sharing and Improvement site. And you'll see 3 video stories there. We also have a suite of narrative stories as well. And our stories support improvement by learning, sharing and improving in our system. Where can we use our stories? Or how can we implement them into applicability to our front line? Well, we can use them for education training purposes. We can also use them at the start of our meetings, any gatherings that we have, any conferences that we have, or any workshops that we have. And it helps to focus the mind. So I would ask, if you have a story to tell, or your colleague has a story to tell, or a service user or their family have a story to tell, please don't hesitate to contact us on the QPSIM email address there. But as I said before, it takes a while to develop the story. So if you want to talk about a story in terms of where it can go to, then and you want some advice, or you want to talk about a story from an incident management, either positive or negative, we do encourage the positive stories as well. Please don't hesitate to contact me. John, I'm going to hand back to you.
Thanks, Loretta, and certainly would encourage people to check out some of those resources there. And thank you for that talk. It's a pleasure now to introduce and ask Ger Kilkelly to tell her story, because Ger, you're obviously working in quality and safety, but you also are a patient and have had a story that you'd like to share with us.
Good afternoon, everybody, and thank you, John. I suppose my story, I work in quality patient safety, but my illness was 9 years ago. And I suppose just from a patient perspective, at the time I worked as a clinical nurse manager. I was on a busy medical ward. I had a young family, and I suppose I became unwell what seemed over a short period of time, but unbeknownst to me, I had a congenital heart defect and required surgery. And I suppose at the time, the suggested length of stay in hospital was approximately 1 week, and my recovery was going to be possibly 3 months, and I'd be back to normal. However, this ended up being 3 to 4 months stay in hospital, and this was on the site I actually worked on. And I had a somewhat, I suppose, stormy 18 months recovery before being able to return to work. And I suppose for me, as a healthcare professional, my diagnosis came as such a shock, and it was, I suppose, really disbelief. I suppose at the time as a patient, my biggest emotion was fear. Possibly because I no longer felt in control. I was in an environment I was so familiar with, and yet I was no longer the nurse, I was the patient. And my story, I suppose, isn't isolated. It represents countless other patients that come into our service. And I suppose, as a healthcare professional, they're just one of the slides that Loretta shared with us, tell me a story and would live in my heart forever. As healthcare professionals, the impact of a patient story can live with us throughout our career. And I suppose I can recall stories shared by patients from earlier on in my nursing career that still remain so clear and so vivid. And I suppose it's very interesting as students, we're often directed, to go and sit and talk to the patients at their bedside, and possibly, at that time in our career, I feel, we don't have the full insight or awareness, of the extreme value of listening to each patient's, story, their own authentic voice, and sharing their experiences as well, and what was really important to them at that time. And I suppose also Loretta mentioned there, stories can be positive, they can be negative, but can inspire us and really challenge us to think in new ways as healthcare professionals. They can really catch our attention and our engagement. And I suppose we can get stuck in that moment. And as you alluded to, John, to the good and the bad moments, when all hope, felt like it's all gone. And it provides that vision, I suppose, is past, the vision of what is past, and I suppose what is possible to support and change in our practice. And I suppose for me, I'm planning on sharing my story next month. And I suppose for me, sharing my story really reflects my vision through a very different lens, I suppose, as a patient, as opposed to through the lens of a healthcare professional, caught in that moment in time when we're delivering care. So I suppose that's my snapshot of my story, but it will be shared next month. So
great, and thank you for that, Ger. And how does it feel to get the chance to tell that story?
I suppose initially, John, I was quite reluctant. I had returned to work and had gone into a completely new role because I couldn't go back to a clinical setting. I had new colleagues, and I suppose, they asked about my time off and what had happened. And I suppose it took a lot of courage and time as well. It was all about building relationships with them. And I suppose feeling, having a safe space to share that story. And I suppose, again, it's very different when you have to read it out loud and share it, as to what's internally in your heart and the emotions you feel at the time.
Yeah.
But it was a great opportunity. And I think there's healing in it as well. I really do.
Yeah. Yeah, healing for everyone, I think, who touches the story, for the teller and for those who hear it as well.
Yes, I think so.
Yeah. And again, I'm struck by your own situation. You're both somebody who works in the health service and somebody who has received care from the health service, and so many stories have all of the things together. They're both good and bad. It's not that they're one or the other. And I think that's something almost, it's impossible to convey the complexity of some situations unless you tell stories.
Yeah, and it's very true, John. And I think, even the bad moments can be very powerful because we learn so much from those. And it's the very simple things that make such a difference and have an impact on the patient's experience as they journey through our care. So, there's learning in every moment.
Yeah. Thanks, Ger. And Loretta, where did the idea for using stories come from?
Well, I came into the QAV in 2017, and there were a number of stories that were already developed. But on the launch of the Incident Management Framework, we worked with Patients for Patient Safety Ireland, and one of the chairperson at the time supported the launch of the Incident Management Framework and worked with us with her story, and we developed it to video stage. So we were allowed to use that video as we did the roadshow in terms of launching the IMF. So that's where my journey began. My journey began previously in other countries, but in terms of Ireland, that's when my journey started. Yeah,
super work. Thank you. I'm going to hand over to Gemma and to Jacqui now, and they're going to talk about some of the work they've been involved in. So Gemma is a qualitative researcher and works in evaluation within NQPS, and Jacqui is a member of the Safety and Quality Committee of the HSE board. Gemma, will I hand over to you?
Thanks, John. Hi to everyone from a very sunny Dublin. I hope everyone's getting an opportunity to get some fresh air over lunch. What myself and Jacqui are going to talk to you today about is, I suppose, one of the ways that us in NQPSD have brought patient, service user, family and staff stories is to different leadership teams, boards, committees. So John mentioned earlier that, this kind of message around no data without stories and no stories without data. So we have co-designed with the Safety and Quality Committee and some previous boards and committees I'll talk about in a moment, 2 items on their agenda. One is a quality profile. So that uses SVC chart data, quantitative data, and looks at indicators across 7 different domains of quality. And I suppose the qualitative and the stories bit comes in what we call people's experiences of quality. And so that brings, as people have said before, the positive and negative, patient, service users, family, and really importantly as well, staff stories and experiences, and they're shared at meetings. So this work has evolved, and a number of the people on the call today, including John and Maureen, have been involved in different parts of this work. So we developed it initially with the Mater Hospital Board, then the CHI Temple Street Board, and more recently with the HSE Directorate and Executive Management Team. And when the HSE Board was formed, that work was handed over to the Safety and Quality Committee. So, why is it important that these people's stories are brought to the committee or to a meeting? So the purpose really, and I think a lot of people have touched it in this in the previous speakers, but also I've noticed in the chat box that, really to look at a person's experience sets the tone, grounds people, at the start of a meeting. It helps maybe a committee look at different things they are, they if you imagine a committee, Safety and Quality Committee meeting, and Jacqui, you might attest to this, there's a lot of reports, there's a lot of data, there's a lot of graphs, and this is something quite different. It's a moment for them to kind of step outside those numbers and words and just, take a bit of time to pause and listen to a particular story or person's experience. And it helps them understand people's lived experiences, both good and bad, and how those experiences can impact the person, their lifestyle, their family, and also maybe help them reflect on how they might feel about a particular topic. And there was a quote here, I think, that was particularly kind of summed up why, when we worked with the directors or the leadership team in the HSE, they said that they often feel quite removed from the stories of individual or from patient contact or from frontline staff contact. And this kind of reminds them of why they're here, what's the purpose of the meeting, and why it is they're turning up to work every day. And I think something that's worked really well is to use a variety of ways to bring people's stories at meetings. So we do use people like narratives, written narratives, and often probably videos are something we frequently use. So that gives the person who's sharing their story, the time and space maybe to tell their story in the way they want to. But we've also had people just attending the meeting. So, dialing into the Safety and Quality Committee and having a conversation with the committee members. And that's really powerful, I think, because that kind of opportunity, that two-way dialogue. Research findings are something we use quite a lot as well. So there's so much good research out there, and lots of, particularly the kind of qualitative content that might be interviews, focus groups, and kind of looking in at some of that in detail at the meetings and with the researchers and sometimes the people involved, the participants in the research. But there are other ways, surveys, and particularly maybe the open questions. The committee members or management team can actually, take time out and visit, like have a walk around, and there's some resources on that on our website. Or just sit and have a conversation with someone, as John said, talk to someone about, well, what was your experience like? And that can be discussed then at a meeting. So, there's lots of ways and lots of places that stories can be brought. So, we have worked with kind of the senior, leaders in different organizations like boards, committees, leadership teams, management teams. But they're also really valuable if you're doing a QI project or you have a staff meeting that you think about, could we, include a staff story, a patient's experience, something a family maybe a comment they made or feedback in positive or negative. And just taking that time out to kind of discuss that, I think, is really valuable. I'm just going to ask Chris to play this. This was, we have a podcast and we'll send the link out, a podcast series. And myself and my colleague did an interview with Dr. Deirdre Madden, or Professor Deirdre Madden, who's the chair of the Safety and Quality Committee. We asked her, what the impact of hearing these stories at meeting was.
It has a really very significant impact, and I would actually like us to be doing more of it rather than less of it. Again, speaking for myself, I think it's really very simple. how will we know if we're providing a quality service unless we ask both the people who are providing the service for their experience of how they're doing it, and maybe what obstacles they have in relation to that. But actually, for me, more importantly, the people that we provide the service to. How do we know if we're providing a quality service? Well, the simple answer is we ask. And I mean, we can talk about, and we do talk about clinical programs and strategies and policies all day long. And we can, base them on international evidence. We can base them on, expert input and all of that. But in the end, they have to work for the patient, and they have to make the patient's experience of care better. Otherwise, why are we doing it? And we won't know unless we ask. So, I mean, I don't think we can have or say we have a culture of patient-centered care without listening to patients. And as I said, I think we should be doing much more of it, because I think it's been very meaningful in some of the areas that we've looked at already.
You can listen to that full podcast episode, and I think someone's going to share the link in the chat bar. I think I'm going to hand over to Jacqui to talk about this power of stories at the Safety and Quality Committee.
Thank you. Thank you very much, Gemma, and thank you for the invitation to be part of today's webinar. Just to be really clear, I'm a member of the Patient and Safety Quality Committee. I'm not an employee. I'm actually a patient myself, and I have a lot of patient experience. I will be bringing my personal story to the table in terms of enriching the understanding of everyone around the table. So some of the themes and issues we addressed at our committee meetings are really important. And very recently, we did an evaluation of our own work and how we operate as a committee. And we decided to try out from this year, which we've commenced, taking what we call a monthly. We meet every month. So we take a monthly thematic approach. So this is to give you a sense of the kind of themes we cover at different months and at different meetings. And we have stories to reflect these themes. They could be staff stories or patient stories. So, for example, we covered off, obviously, the cyber attack and the huge impact, as you all know, many of you, of the impact of that on the frontline staff experience. And that we've done through qualitative research, one of the many methods that Gemma outlined earlier. Then we also had safeguarding as one of our themes around disability last year. And we had a person who has an intellectual disability speak through video of his experience of safeguarding, and that was done through video presentation. And really, the purpose of these interactions with patients, be they in person or via video or their presentation being brought into the room, is they bring the person into the room. So they bring them front and centre of our committee meeting. And we actually put them up very early on in our agenda so that they inform us and they guide us throughout the rest of that meeting. So they're always thinking of the people at the centre. You know, we talk a lot about person-centred planning, but for me, this is one way of bringing the person right into the room. Because in my experience, and I've done a lot of training with professionals as well, from general practitioners right through to other specified professionals, so often you're taught to bring your skills to the bedside or to the patient. Well, this is the one opportunity that we were actually bringing the patient's experience from their bed or from their service into the room of policymakers, decision makers, advisors to the HSE. So that's really important. So it's a two-way street. This is what we're trying to develop here. And other examples that we've had is around trauma. We had a young lady speak with her consultant jointly. So it's a really, really rich meeting where both in person and through video, we heard of their story. And women's health, we had through research findings, the women's health issues being brought directly into the room. Again, similar for a paediatric service. So it's a huge breadth. And the National Ambulance Service, we heard directly from the front line, very strong presentation around the experience of ED handovers by National Ambulance personnel. And then, indeed, we've heard already today from Ger very kindly presented to us as part of the patient safety story not too long ago. And that was a very rich meeting as well. And it was particularly valuable because she was able to talk from both angles, knowing being a staff member and a patient, which is a very unique perspective to bring to our table. And then from the disability angle, very recently, as a more recent meeting, we had service users, 2 young men talking to us about their experience of transitioning from children's services into adult services with a lifelong impairment. So these are just some of the examples just to share with you. So the stories, from my point of view as a committee member, are really important, really significant. And please continue to collect your stories and bring them to our attention. And we value them hugely. So don't feel they're going to waste. And Gemma.
Thanks so much, Jacqui. Thanks so much. So we've developed a number of resources. I suppose the one I'll point you to is the toolkit. So this is for people who would like to replicate both the stories, so the people's experience of quality piece, and there is a lot of tools and resources around if you're interested in developing a quality profile. So that's around, using SPC charts and that, no stories without data, no data without stories. But there's, if you can, I think someone's going to pop that in the chat box. There's a number of publications and journal articles. We have case studies where we, summarise the learnings we had with the different groups we work with. And we mentioned the podcast before. So thanks, John. And back over to you.
Thanks, Gemma, and thank you, Jacqui. And I might just ask Jacqui a quick question just before we kind of open things up. And Jacqui, do you think can you recall a time when hearing a story at the beginning of your meeting set the tone or galvanized, I think, the group to address something or to do something?
Absolutely. I can think of at least 3 different meetings where people at our table were, to put it frankly, we were up in arms at what we were hearing, and rightly so. And that really focused the mind because, it's been alluded to earlier, John, that we get, I can tell you, hundreds and hundreds of pages of documentation to read in advance of our meetings. And you can get drowned in paper and lose sight of the people. So for me, it's very important. So yes, they do have an impact for sure, because when we come to the end of our discussion at each item, we usually say, well, right, what are we doing with this item? What is our recommendation? Where is this going? So we'll go right back to be it John or Jacqui that spoke to us half an hour earlier or 40 minutes ago earlier. And we go back, what is it that we to reflect from their experience that is useful or valuable or should never again happen? So that helps.
Great, thank you. Juanita, have we got some comments in the chat? I saw some lovely, some lovely comments on the value of story there. Kind of, the making services more relatable, personalized, deeper understanding, insights, meaningful, relatable. So lots of things I think about relationships again, informing, connecting. Helping to improve insights and increase empathy. So I think the audience certainly likes the idea of storytelling.
That's it. And it's interesting. There's two questions here. You could probably do a full talk time on both of them, actually. There's one in particular from a lady called Natalia. And she's wondering, I suppose, a little bit around how, I suppose, patients, PPI contributors perceive their experience and the power struggle in terms of how they might be perceived as equal to staff stories. And, just thinking about that, I suppose that patient knowledge or experience versus somebody that's their medical expertise and they're trained, is there that sort of unequal power dynamic or do you think that it's given equal weight? And maybe that's one for Jacqui from sitting at the board level, that perspective, you have a different insight there.
Yeah, I would a lot of experience in the world of disability and disability advocacy and patient advocacy. I think we have a lot of work to do to empower and give confidence and safety to people to speak up and to still tell their story. There's still many stories not told. And so you have to meet the right person at the right time in the right place to be given the space to tell your story. No matter how much you might say to someone, oh, you're guaranteed confidentiality and everything else, I don't know that everyone believes that. And sometimes even people couldn't be very upset telling their story. So how are we going to support them in doing that? I really think we should go right back to the person. And are we stopping people for their story, but are we going to do anything with it? Are we going to leave them high and dry? So there's all of that stuff around how we support somebody and not say thanks very much and cheerio and close the door behind us. So it's a tricky one.
It is, and I think it has to be given a weight, because there's a huge vulnerability when you go to share your story, and Ger touched on that a little bit earlier on and in the preparation. When you go to share a story, it's very personal to you, and it can be very emotional because it brings up so much in terms of your experience. So the right time, and Loretta touched on that as well. It's interesting around the confidentiality piece, and maybe this is one for Loretta. This had come in that you'd worked with patients and had permission to use their stories, and if the stories are sufficiently anonymised and edited. But from a GDPR confidentiality perspective, do we still need the patient permission to use their stories, not just at a board meeting level, but during information sessions, etc.? If we capture the story, can we continue to use it? How does that work?
That's part of the preparation work. As I was saying when we were going through the presentation, in our guidance document, we come up with a final product, but that final product takes a journey to get there. And part of that journey is the understanding of, the process and the ability. When somebody tells their story, that we have the opportunity to be able to use that story in a variety of settings. But likewise, the staff member or the service user or their family have the opportunity to withdraw their story at any time.
Okay.
So I think my learning from stories is time, pace, and understanding.
Okay, that's really helpful, Loretta. Thank you. And I think that the toolkits are available to support people with some additional information, and they can be applied within your service on a day-to-day basis, or they can be applied within sort of more senior management team meetings and so on. But it doesn't have to have a very complicated process. It can be as simple as hearing and sitting down, as John mentioned, sitting down with somebody, having that one-to-one conversation, and then bringing that to the next team meeting. It can be a very simple process about how we use them. I'll just ask one final question. I'm very conscious that the time is moving quickly. So just Gemma, how did you know what board members were seeking from stories when you began this work?
Thanks, Anita. I think we very much took a co-design approach with this work. So we had workshops where we, teased out what it was that, the Safety and Quality Committee wanted. And, one of the big pieces of feedback we received from the committee was, we want to hear a patient story directly from the patient. We don't want, someone else telling their story. If a staff member is telling their story, they tell their own story because they have their own perspective. They have, but the other thing, so we brought in then, I think Jacqui has mentioned the themes. So that's something the committee wanted. They wanted to, request specific stories on specific themes that matched into other things they were talking about. We've done evaluations, so I've interviewed all the committee members to get their feedback, and we're continually tweaking, improving, and importantly, we also kind of get the feedback from the people who share their experiences, and that has really helped us. Because we've lots of meetings before and after they've attended the committee, and that has helped us kind of refine this item and know what they need and how they want to share their story.
Okay, perfect. Look, thank you so much. I'm conscious that it's just coming up to 2:00, so I'll go back to John, but just say thanks very much to our panelists, and thanks very much to the participants for sharing your questions with us as well. Thanks, John.
Thanks, everyone, and we could keep on going here. Lots of good questions there. So I think we've got that's our list of resources from NQPS, and you'll see there that there's links as well into some of the things we've been talking about today, into the various resources for story and storytelling, and where the patient voice can be heard. And that's in our most recent edition of Quality and Patient Safety Matters. I think you'll find some top tips for effective patient partnerships with Joan Johnson. So again, recommend checking that out. And of course, in there is plenty of material about storytelling. Finally, just again, a reminder to people, please get yourself on the QPS Ireland network map. if you're not on the map already. And if you are on the map, then please encourage somebody else that you know to get on the map, because we want to link people up and for people to know what you're doing and where you are. And equally with the Q community, please, if you've not checked this out, Q offers lots of advantages if you're working in quality improvement to connect with people across Ireland, Northern Ireland, and the rest of the UK. And so there's our Patient Safety Together website. So lots of the resources we were talking about today are to be found there. So again, I'd encourage people to check that out. So just to flag, our next webinar is on the 13th of June in 2 weeks' time. It's on safeguarding. And so we'd encourage you to set the time aside for that. And then our final webinar at the end of June is with Dr. Anna Burhouse from the UK, who's going to talk to us about psychological safety. So this is a term that keeps on coming up again and again, and I think we're going to do a deep dive into that with Anna Burhouse. Just going to finish up by saying, you can find previous QPS Talk Times on the YouTube channel. Please do get involved in Twitter and join the conversation, and there'll be lots of posts, I'm sure, from today. And then finally, just please do feedback to us on the feedback form when you leave this webinar. So I look forward to seeing everybody in 2 weeks' time, and all the best. Enjoy the sunny weather. Bye-bye.